Now coming to the second lecture, that is factors modifying drug response and the different drug interactions. Now in this lecture we are going to see what are the different factors which can change the response of the drug or which can modify the response of the drug and the different drug interactions. So many host and environmental factors affect the drug response. So be it the patient or the different factors of the environment. So both of these things can influence the response of the drug. Now sometimes what happens is variations in the response to the same dose of a drug between different patients and even in same patient on different occasions can occur. So different patients can respond differently to the same dose of a drug. Okay, and sometimes same patient can respond differently to the same dose but on different occasions. This also leads to the factors which can modify the drug response. So response of the drug is does not I mean the response of the drug does not depend only on the amount of drug that is administered, but it also depends on many different factors. So only whatever drug we are giving, that does not produce a response. Apart from that, it can be modified or it can be changed with due to many different factors. So sometimes the dose of a drug that is right for you may be very little or very high, very little to produce an effect or way too much to produce a side effect for others. So whatever dose is correct for you, there are chances that sometimes that same dose might be very little for someone or it might be very high for someone to cause side effects. So what are the different factors which are modifying the drug response? So these factors can be classified into physiological factors, pathological factors, genetic factors, environmental factors, and interaction of drugs. So these are the five broad factors which can modify the response. Within each factors, we have many different small sub factors which can or which are responsible or which may be responsible for modifying the response of the drug. So we will start with the first one, that is physiological factors. Now in the physiological factors we have age, gender, pregnancy, plasma protein binding, body weight, lactation and food. Now this is very simple. You will already have a background in your mind regarding these factors. Okay, you can tell, but we will see what can be the reason for that. So age. Children who are under 12 years of age, they require less dose when compared to adults because their metabolizing enzymes might be less or their barriers, that is blood brain barrier or blood aqueous barrier, may not be fully developed. So a fraction of adult dose must be given to children who are 12 years or younger than that. If this if the same dose is given, it might cause, if tetracyclines are a category of antibiotics, if they are given, it might lead to permanent staining of the teeth. Or if steroids are given to children, it might lead to retardation of the growth of the child. Next, coming to the gender. Okay, before gender, we will also see what happens to the drugs if they are given to newborns, that is the the newborn babies. So in these babies also, the drug dose has to be adjusted and it has to be very less when compared to the normal child dose. Because what can be the reasons? The reasons are the acid production in the stomach will not be too strong. In the liver, the enzymes might be deficient. Plasma protein binding might be less. Kidney function might not be well developed. That is, glomerular filtration, tubular secretions might not be well developed. And blood brain barriers also may not be developed. So, stomach, liver, kidneys, barriers, and plasma protein binding. All these things may not be well developed. So, in such cases, drug or the dosage of the drug must be less in newborn babies. Now, example of gastric acid secretion. So GIT absorption of antibiotics such as in the penicillin class such as amoxicillin, ampicillin is greater in neonates due to decreased gastric acidity. So their gastric acid is very weak and very less. So these drugs will be absorbed to a greater extent. For the liver, chloramphenicol, if it is given to neonates, it will cause gray baby syndrome. So what is gray baby syndrome? We will see in the next slide. So remember chloramphenicol. Blood-brain barrier. If sulfonamides are given, sulfonamides are a category of antibiotics. If they are given, then it might lead to underdeveloped or it might lead to the development of jaundice, hyperbilirubinemia, or kernicterus. That means some damage to the liver. Next, coming to gray baby syndrome. So gray baby syndrome is a syndrome. Syndrome always means it consists of many different diseases together or many different signs and symptoms together. So it is a rare but serious side effects which is seen in newborn infants, especially if they are premature. Following the accumulation of antibiotic chloramphenicol. So chloramphenicol causes gray baby syndrome. What is chloramphenicol? It is a bacteriostatic antibiotic. Bacteriostatic antibiotics are those antibiotics which inhibit the growth of bacteria. Bactericidal means they completely kill the bacteria, but bacteriostatic means they inhibit the growth of the bacteria. So it was initially developed and designed for the treatment of typhoid, but suddenly it came to know that it is developing loss of appetite, vomiting, gray color of the skin, hypotension, blue color discoloration of the lips, hypothermia, that is decrease in the body temperature, cardiovascular collapse, and irregular respiration when it is given to the newborn baby, or if it is given to the mother also, it might go to the baby via milk. So this is known as the gray baby syndrome, which develops by the due to the accumulation of chloramphenicol in the newborn baby. So in such cases, such type of drugs must be avoided. Now coming to the elderly people. Now we have seen about children below 12 years, we have seen about newborns, and now we are seeing about the geriatric age group, that is more than 60 years. So again, the elderly people, they also require special consideration when prescribing drugs, because as they become old, their body weight decreases, their body fat decreases, their intestinal motility also decreases, blood flow to the intestines also decreases. That is why, keeping in mind all these things, their renal function, their hepatic function will be reduced. So keeping in mind all these things, elderly people, they require lesser dose when compared to the adults. So liquid preparations can be usually preferred for such type of people, so that it is easily absorbed. For renal function, reduced renal function, the drugs such as diazepam and theophylline, they have a greater half-life. In the normal people, the half-life is 2 hours, but in elderly people, it can be extended, or it is up to 90 hours because of reduced renal function. It will not be excreted easily from the body. Similarly, digoxin and aminoglycoside, they also have decreased excretion from the body due to reduced hepatic function. Next, coming to the gender. So in males, the testosterone hormone is more, so it increases their biotransformation. Males have greater BMR when compared to females, so there are chances that it might be digested very quickly. Drugs which are used for the treatment of ulcer in females may cause increased prolactin level. And during menstruation, if salicylates or any other strong purgatives are given, they might cause increase in bleeding. Purgatives are those drugs which loosen the stools. So in during menstruation, if these drugs are given, they might increase the bleeding. Next is pregnancy. Now you all have a basic idea that drugs should not be easily prescribed in pregnancy unless and until it is very much necessary. So uterine stimulants, the drugs which stimulate the uterus, or purgatives, or drugs which might have teratogenic effect on the fetus, should be avoided, especially during the first trimester. And during the labor pain, morphine should not be given, because morphine is a painkiller. It is a very strong painkiller, but if it is given, what will happen? It will cross the placental barrier and it depresses the respiration of the newborn. So always during pregnancy, unless and until it is necessary, drugs should not be prescribed. Plasma protein binding. Now, malnutrition. If the patient is suffering with malnutrition, he or she will have decreased amino acids, decreased proteins, etc. So, what will happen? The drugs cannot bind to the plasma proteins. So, we have discussed earlier that drug binds to the plasma protein and then it crosses different barriers and goes to the site of responses, right? So, malnutrition. In malnutrition, there are chances that the drugs will not be able to bind to the amino acids or proteins, and it might lead to decreased effect. Food. Drug food interactions. So drug food interaction might have two responses. Either it may decrease the absorption of the drug, or it may increase the absorption of the drug. So example for decreasing: calcium containing foods and tetracyclines. What will happen? The absorption of tetracyclines will be reduced if it is given with calcium containing food such as milk or curd or any food that is containing calcium. High fiber foods also reduces the absorption of drugs. The drugs which increase the food and drug interactions which may increase the absorption. So if high calorie food is taken, high calorie food, you already know what is high calorie food, right? So if high calorie food is taken, example is it will double the absorption of sequinavir. Sequinavir is a antiretroviral drug. So some drugs may upset the stomach if taken without food, and anti-motion drugs are taken on empty stomach. So there are different categories of drugs which are classified and which are some have to be taken with food, some have to be taken in empty stomach. So it depends upon the characteristics of the drug. So this is about the food drug food interaction. Body weight. Dose of the drug is given per body weight kg. So average whatever adult dose we are seeing, on average it is calculated according to an average weight between 50 to 100 kgs with 70 kgs as an average. Lactation. During lactation, drugs may be excreted through milk and may affect the infant. So purgatives, penicillin, chloramphenicol, we have just now seen, oral anticoagulants, these are the drugs which which are excreted via milk and it might affect the fetus. So these are the physiological factors. It is very simple: age, gender, food, etc. So all these things, how they are affecting the absorption of the drug. So you already will have a background, but you have to remember the examples. Second is pathological factors: liver diseases, renal diseases, malnutrition. So you know that if a patient is suffering with liver disease, what will happen? The half-life of the drug will increase because the drug cannot be metabolized easily and the hepatic blood flow will be reduced, so drug cannot be cleared easily from the body. So there are chances that the half life of the drug will be increased. So if hepatic blood flow is reduced, clearance of morphine, propranolol may be affected. Similarly for renal diseases, if the patient is suffering with any renal diseases, there might be also accumulation of the drug in the body. So it might lead to abnormal effects of, example, digoxin, gentamicin, penicillins, etc. Change in GFR means glomerular filtration rate or functions of the kidneys. Malnutrition, we have already seen, plasma protein binding of drugs and the amount of enzymes is reduced, which leads to increased portion of free unbound drug. Example is warfarin. So free drug is present in the body of no use. It cannot bind to any plasma protein. So the effect will be reduced. So that is about malnutrition. Next, coming to genetic factors. So genetic factors also we have just now seen in the previous lecture. Idiosyncrasy. So genetic abnormalities also influence the dose of a drug and the response to drug. So idiosyncrasy means abnormal drug reaction due to genetic disorder. So it will be very unpredictable and it might be seen on the administration of first dose of the drug. So all individuals, they do not respond in the same way, but if the person is having any genetic disorder or if his or her genes are reacting to the drug, there are chances that he or she might produce some abnormal response to that drug. Example, deficiency of glucose 6 phosphate dehydrogenase. So G6PD deficiency in RBC leads to hemolytic anemia. So this is an enzyme which is present in the RBCs. But if it is absent or if it is deficient, then it will lead to hemolytic anemia. When does it lead to hemolytic anemia? If it is exposed to other oxidizing drugs such as antimalarials, long-acting sulfonamides. So now a patient is there, he is having some genetic problem. What is the genetic problem? On his or her RBC, the glucose 6 phosphate dehydrogenase enzyme is deficient. Nothing will happen. He or she will live a normal life, but now an anti-malarial drug is given or a sulfonamide is given to that patient. Suddenly he or she will develop hemolytic anemia. So on the first dose itself, they develop anemia. Hemolytic means the hemolysis. Lysis means breakdown. breakdown of the cells leading to anemia. Why? Because there is a genetic problem. What is genetic problem? There is deficiency of an enzyme which is present on the RBCs. So this is the example of a genetic factor. Environmental factors. There are different environmental factors which might also affect the response of the drug, such as route of administration. Some drugs are absorbed very good when taken by oral route. Some drugs are incompletely absorbed after oral route. They have to be given intravenously, etc. So some magnesium sulfate, if it is given orally, it acts as an osmotic purgative. If it is given by intravenous route, it is responsible for controlling convulsions in eclampsia of pregnancy. Okay, during delivery, some people might develop convulsions. So, magnesium sulfate by IV route can be used to control that convulsion. So, drugs, if they are given by different routes, sometimes they might have different actions also. Time of administration. Now, hypnotic drugs, the drugs which produce sleep. No doubt they produce sleep whenever they are taken, but the effect will be better when these sleeping pills are given at the night when compared to when they are given in the day. So, in the night, if these sleeping pills are prescribed, there are chances that a smaller dose can be given. Effect of climate. Sometimes the action of some drugs might be affected by climate also. So metabolism is low in hot and humid climate. Purgatives act better in summers. Diuretics act better in winters. So diuretics are the drugs which increase urination. So it is obvious that urination or diuretics they act better in winters. Purgatives are the drugs which loosen the stools. They might act better in summer. So sometimes climate also affects the metabolism of the drugs. Racial differences. Now, some population of the world might act differently to some drugs, but the same drug might not have any effect on other population of the world, depending upon their racial differences or depending upon their genetic makeup. For example, castor oil. Castor oil is a purgative. This castor oil is ineffective in Chinese population, so it will not act in Chinese population. Similarly, the dilating effect of pupil. Pupil means in the eye you have a black color thing, right? That is pupil. Dilating means to make it big. So that dilating effect of ephedrine drug is absent in Negroes. So if you give ephedrine to Negroes, it will not cause dilation of the pupil. So there are chances that some population might respond, some population might not respond. Preparation of the drug. So you know that solid dosage forms they disintegrate slowly in the body. So they have to be broken down and they have to undergo dissolution and then they have to be absorbed from the body. Whereas liquid dosage form they will be rapidly absorbed from the body. That is about the dosage form of the drug. Age of the drug. Now, action may be modified if kept for longer duration. Now, you know that if the drug is expired, what will happen? It will lead to adverse reaction if an expired drug is taken. For example, outdated tetracyclines, if they are taken by mistake, what will happen? It will lead to excretion of all the amino acids in the urine. Or chloroform, carbon tetrachloride, if they are taken, they will be toxic to the body. However, all the drugs, whether if they are expired, they will be definitely harmful or toxic to the body. So it's about the age of the drug. Acidic or basic medium. Acidic drugs, I told you in the first class, weakly acidic drugs will be absorbed in the stomach, weakly basic drugs will be absorbed in the intestine. So if GIT has decreased acidity, then acidic drugs are not effective orally, such as penicillin, benzyl penicillin. So if the acidity of the GIT is reduced, then what will happen? Decreased acidity, then acidic drugs will not be absorbed effectively. Effect of diseases. So again, certain drugs are not effective in disease conditions. Sorry, certain drugs are only effective in disease conditions. So there are some drugs which are effective only in disease conditions. For example, antipyretic like aspirin, paracetamol, they reduce the temperature of the individuals who have fever. But if these drugs are given to normal person, they will not reduce their temperature, right? So whoever is having fever, these drugs will act and reduce the fever and bring it to a normal temperature. But if a normal person is taking paracetamol, that does not mean that his or her temperature will be reduced more. Similarly, iron is better absorbed in iron deficiency anemia. As the anemia improves, it will have less response. So if the person is deficient, if the person is having iron deficiency anemia, then iron will be well absorbed when compared to a person who is normal. Next, coming to drug interactions. Now drug interactions refers to the drug-drug fight. Okay, how one drug is responding or how one drug is modifying the response of another drug. So you already know this also from our pharmacodynamic responses. Okay, drug-drug interactions. That means you have studied synergism, antagonism, right? So drug-drug responses means how one drug is modifying the response of another drug when they are given together or if they are given quickly one after the other. So this can be either improving the absorption of one drug or fighting with the drug. So it usually occurs when patient receives more than one drug and the chances increases with the number of drugs taken. If the patient is taking one drug, no problem. If, if the patient is taking more than one drug, two drugs, then there are chances there can be a drug-drug interaction. So the number of drugs, how the number of drugs are increasing, that many chances of drug interactions will be increased. So the modification is mostly quantitative. Response is either increased or decreased, and it might be qualitative also. An abnormal or a different type of response may be produced. So when two drugs are interacting, the response might be quantitative or qualitative. Quantity means increase or decrease. Quality means whether it is an abnormal response or a different type of response. So many medical and dental conditions, they are usually treated with a combination of drugs. So always care should be taken that the two drugs which are prescribed, they must not interact with each other. Now, mechanisms of drug interactions. So, the drug interactions are classified into pharmacokinetic interactions, pharmacodynamic interactions. So, pharmacokinetics, absorption, distribution, metabolism, excretion. So, what can two drugs do to absorption? What can two drugs do to distribution? What can two drugs do to metabolism? And similarly for excretion, we will see. Absorption. Now, this case is for two drugs, two or more drugs. So, absorption can be affected by concurrently ingested drugs. This can be due to the formation of insoluble or poorly soluble complexes in the gut. So, two drugs can react with each other and they can form insoluble or poorly soluble some complexes in the GIT. Example is tetracyclines and calcium, or tetracyclines and antacids. If they are given together, or if they are given quickly one after the other, they might form some insoluble, not that is they are not easily soluble, some complexes which are not easily soluble. In such cases, what can be done? Now, two drugs has to be taken, so that two drugs can be divided by time. To minimize this, the two drugs can be given with a gap of 2 to 3 hours so that they do not come in contact with each other. So that can be done to prevent the interactions during absorption. Next is distribution. Distribution means how they are distributed. So these type of interactions are due to displacement of one drug by the other drug. So one drug will be displaced or removed from its binding site on the plasma protein by another drug. So what will happen? One drug has bound. So the other drug will come and it will displace the bound drug, and it will raise the concentration of the drug in the plasma, which may result in toxicity. So drug, it goes into the body, it binds to the plasma proteins, and it goes to its specific site of action, produces its action, and then excreted from the body. But over here, what is happening? When the drug is going and binding to the plasma protein, another drug comes and removes it from there. And this, due to this removal, the drug is getting accumulated in the plasma, leading to increased concentration of free drug in the plasma, which may result in toxicity. Oral coagulants and NSAIDs. The example. Metabolism. Two drugs can either increase the rate of metabolism of each other, or they can reduce the rate of metabolism of each other. Both the cases are harmful. If they increase the rate of metabolism, both of them will be metabolized quickly, or one of them may be metabolized quickly and it will not produce the desired effect. Or if the metabolism is reduced, then it will remain in the body for a longer period of time and it might produce any other harmful effects. Antifungals, ciprofloxacin, metronidazole are the drugs which inhibit the metabolism of multiple other drugs. Next, coming to excretion. Seen in drugs actively secreted by tubular transport mechanism. So the drug which is known as probenecid, it is used for treating gout. It inhibits the excretion of penicillin and cephalosporin. So if these two drugs, penicillin and probenecid, or probenecid and cephalosporins, if they are given together, then probenecid inhibits the excretion of penicillin and cephalosporins. So they remain in the body for a longer period of time and they can accumulate or they can produce other side effects. These are the pharmacokinetic drug reactions. Now coming to the pharmacodynamic drug reactions. So we have studied in the last class, if you remember, I have pasted those slides over here. So pharmacodynamic interactions are same, that is synergism and antagonism. So type of synergisms and type of antagonisms, these are classified under the pharmacodynamic interactions. So this is the lecture about the different factors which modify the drug response. So all these factors can modify the response of the drug.